My name is Kellie Maxwell. I work for the Center of Urological Surgery in St. Louis, Missouri. Our case volume is 375 cases per month, and we can increase that. We're not at full capacity yet. And our specialties are urology and neurology with specific of, spine procedures. E-chart, the practice management, profit forecasting, and clarity. We started implementation in the 1st of November and are using it just in the business office right now. That started in January, and then next month I'm actually going to be on site and working in the schedulers and the patient financial clearance folks. It was very difficult and time consuming, obviously, and in the manual process, but probably the biggest hurdle was staffing, in that if it was someone new that was moved into the scheduling position or out sick or somebody else was filling in, they didn't understand the spreadsheet. And then equally so, the spreadsheets would only updated maybe twice a year at best. So again, with it being physician owned, we had no way of catching new procedures or anything else like that. Things would just kind of flow through. I would spend hours at month end doing it, hours. And then on top of that, our accountant, CFO, who's a forensic accountant, would also spend numerous hours working on that on the back end for financials for the board. It's just them not having the information at their fingertips to make good decisions. Everything always had to roll uphill, to management to make a decision. It would be us being able to communicate. I mean, seeing it at a doctor level, a surgeon's level. And one of the things we're going to do is give the scheduling supervisor access to it so that, that way her people can speak and they can look before they even contact the surgery center, so we're not canceling as many procedures once they get on the books. I started the process from the business office, then presented it to the administrator for the center, who then took it to the practice management folks and board. I look at it daily, and what I'm looking for are first-time procedures that a physician, has done at the center, because it immediately comes up with 100% profit. So they're really easy to find. The materials management person, is using the implant, checking for cases that have implants. That really was never a very big struggle for us. I don't know why, but they evidently had a really good handle on that part of it. It works good for me because my billing, the actual billing team then can make sure that we are billing for an implant if it doesn't get marked on a schedule or, on the billing sheets. So I look at it daily just to look for those sorts of things. And then billers themselves, my billers then will have been using it just to kind of, if they've got a question from the coding, folks, it just kind of helps streamline where we can go look for something. Scheduling, we'll use it every day, like I said, to look and make a determination and know when. We build some flags in when it does need to go to management so that they physically don't have to type an email or walk over to the office. She knows to look daily at anything that's assigned to her. So that's how we use those flags. And then pretty much anything after that, I think, and I'm trying to kind of piece together where the financial clearance person could use that as she's working through those. And in my head, I see benefit, but we just haven't worked through it until I get on site. Seconds. That part's amazing. But again, for me personally, that is very quick. And again, it's empowering the front office people to be able to make a decision on the fly or right away and not have to spend sometimes days trying to figure out if we can do a case or not. But it's identifying things that we haven't done before that we really should be analyzing. I know that most facilities, there's a process for doing new procedures, but it doesn't always work out that way. And it's usually when a denial comes in that we find that, we shouldn't have done that case, or did we research it enough? Did we, maybe we needed to get a carve out for the insurance companies, or something like that. Yes and no. It's identified that certain urological procedures just are not profitable, and they choose to do it. But it's identifying them and bringing it to the forefront, because you're not going to make money on every case. I mean, that's just not going to happen. But at least now they're aware of it and they know what that is and they know what that amount is, where before it was very abstract. Contracting, when we get to that point, now we're going to have data that we can present, even down to the CPT codes and the type of procedure and implants. I mean, there's just going to be a wealth of information that we'll be able to compile when we sit down with those negotiations and looking for carve-outs. I'm one of those people that just wants to dive in and understand all of it, because I've got a little bit of software development in my background. So that really intrigues me, but just the accuracy of it and it's pointing out weak areas. One in particular is materials management, which those folks do a really good job. And the challenge is the reps bringing in stuff that the doctor surgeon has ordered himself instead of going through materials management and different things like that. So I set up our implant costs to be really what Medicare but what they use. They have a schedule that shows up on our coding software. And that's allowing me now to know if what we're being charged, if it's too much, if there's a better price. So there's a whole little materials management feature with the implants that this is pointing them out, because it isolates them instead of them just kind of getting lost in the shuffle with all the other cases. So I think the implant part, the administrator is extremely excited about it, and the practice management company, they both are super on board and are extremely excited about it. It actually went pretty quick. We had our first call the 1st of November. We started playing with it around Christmas time, mainly because things were starting to show up and I was questioning if they were right or wrong, and they ended up being right. So that then told us on the financial end that we needed to, really reevaluate how we're pulling that the expenses together and stuff. So that was a little bit of a learning curve. And once we got through that, everything just went really fast. But I think that's probably one of the biggest challenges, is setting it up, is really figuring out what your duration times are so that you can get those costs for staffing and overhead correct. I love them. They're so responsive and interactive. And again, me with my background, I tend to maybe ask a little different questions than the normal person would ask, but they're extremely responsive, and they're a pleasure to work with. Absolutely. The cost of it compared to what you're going to get back, it's going to be paid for within a week. At worst case. I mean, there's just one case, the implant part of it, again, having that visibility is huge.